Hello and welcome. A study published by medical journal The Lancet has said that the SARS-CoV-2, which also causes the COVID-19 virus, is an airborne pathogen. Now, this has broadly been known, but this has created some confusion on whether the virus transmits differently from what it used to do earlier, which is in the nature of aerosol droplets. Now, there is also some confusion about those droplets have to be large or small. And broadly, do we know anything more about the transmission of the SARS-CoV-2 virus than before, or at least in the second wave as we are experiencing it in India? So to understand this, I am pleased to be joined once again by Dr. and Professor Manhar Dhanak, a department chair and professor and director of CTech at the Department of Ocean and Mechanical Engineering at the Florida Atlantic University. Dr. and Professor Dhanak also specializes in flow modeling and hydrodynamics and has written several papers of late which are focused on the transmissibility of this virus. So, Professor Dhanak, thank you very much for joining us. So tell us, in the year that has passed, what more have we learned about the manner in which this virus transmits? And is there anything new that we perhaps didn't know and therefore need to be more concerned about?
Good morning, and thank you for having me. Yes, so what has happened is that the touching, transmission through touching surfaces, it appears to be less of an issue than this airborne transmission. And so that makes it more important, I think, because if you take care of it, like wearing masks, keeping social distancing, etc., then that does help significantly. With regard to droplets, what happens is that the larger droplets, when a person coughs, you emit all sizes of droplets. The larger ones basically drop off very quickly to the ground. They are heavier and then they fall to the ground. But these lighter ones stay longer, and that's what the primary cause is for transmission to be through the air.
Right. Right. So when you say the lighter ones don't drop off and they remain, I'm assuming, suspended, how does that work? I mean, could you explain? And is there any analogy that you could use for us?
Suppose a piece of paper, it's flying in the air. If it's a small piece of paper, it's going to remain longer because of air resistance. See, the weight of the droplet wants to make it fall to the ground, but the air resistance tends to keep it up. So you have the difference between the two forces, and for smaller droplets, because the surface area is larger, the air resistance wins. So it keeps them staying longer, and before they fall to the ground. Eventually they do fall to the ground, but they could be blown by a breeze or any kind of disturbance that might be present in the air.
Right. And therefore the next I guess logical question is how long? And you've also done a study very recently in the last few weeks which looked at transmission in toilets, and we'll come to that in a second. But is there any number or time to how long these small particulates or droplets could be suspended or remain suspended?
So in our studies, we found that they can remain suspended for minutes, like about 8 to 10 minutes. They could remain suspended. If it's in still air, right? If the air is still, there's no motion, then that's what happens. But a lot of the times, the air isn't that still. There's even within a room, you may have ventilation and you have air conditioning that will blow things away. Or if you're outside, then also you have breezes that will impact its motion. 3 minutes in a room, in a closed room, is much better than if you are there for 30 minutes, because the chances does increase, as if you have an infected person in the room, over time, this accumulates, and then there's the other part of that is the viral load. How much do you basically ingest, or inhale when you have somebody coughs, and how much of that gets to you? It's also a factor.
Right. So it's possible. Yeah, go ahead.
No, I'm just saying that. So if the person is wearing a mask, person who coughs wearing a mask, then there is still going to be a chance of droplet escaping from the mask, but it significantly reduces the load that it is now in the air, and therefore it helps significantly, even if there is some chance of still being infected.
Right, and I'm going to come to mask in a moment, because that's one area that you did study, and
Yeah.
you were, was profiled extensively last year. So it is possible, therefore, that if in a still room someone maybe have coughed or emitted these particles or aerosol particles, have left the room, and because it's so still, you could come in 10 minutes later and still be exposed.
You could. That's correct. If there's no ventilation or very poor ventilation in a room, yes.
Right, and secondly, when you talked about some kind of breeze or wind, including from an air conditioner, but that could also blow things in your direction.
That is true. We did do some studies in that regard. So if you are what we call downwind of a cough, so there's a wind blowing behind a person who coughs, then it will hasten the transmission of the droplets towards you. If you are in front of that person.
Right. So tell us about masks now. Again, as you've studied this over the last year, any new thoughts on what kind of masks or the usage of masks, and any changes in the way in your studies or the results of those studies?
So what has happened here in the United States is that they have come up with a standard for masks. The FDA here has come up with a standard of what constitutes a good mask. And so they look at three things. One is how much filtration there is through the mask. If you are wearing a mask and something comes through the mask, it depends on the material that you're using in the mask. That's one aspect. The other is how well it fits on your face. So it's important that when people wear a mask, they cover their nose as well as their mouth. Sometimes you find people just cover their mouth and the nose is up, which is not an acceptable way of doing it. But also how well it fits on the mask is important, because what tends to happen is that when people wear a mask, from the edges of the mask, the things can still escape into the air. So that's another thing they look at for a good mask, how well it fits on your face. And the third thing they look at is breathability. So you should be able to breathe well through the mask. The air particles are much, much smaller than these droplets that carry the viruses. And so on a typical cloth mask, if you're wearing a say 2-layer cloth mask, the air moves fine. You go through that. It doesn't work if you're, for example, wearing some cardboard or paper, which doesn't allow you air to get through. So that doesn't work so well. But typical cloth mask work in terms of breathability. So these are the three things that they look at, and based on how they stand up to the testing.
Right. And what about N95 masks, which are considered almost like a gold standard when it comes to masks?
Yes, so the N95 masks are now more available. Before they were not that available. They are, still could be not that, the availability could not be as good as you would wish. But again, what's important with those are, so first of all, the N95 mask, what they do is they do prevent filtration. They do filter well, so they prevent droplets from escaping through the mask, which is the important thing. But what's important about them is that they have to fit well on your face. This is one of the key things that they look at. So each mask is fitted, it has to be fitted properly to your face, and that's one of the challenges that you have. Typically, these are used by medical workers, which is where those they are on the front line, and so that's very important that they
Right.
are well protected.
Right. Last question. So, I mean, the present confusion in some way seems to have started because of the word airborne. Now, is there a distinction, or was airborne always the right word to use in the context of SARS-CoV-2 or COVID-19 virus transmission? Or is there any distinction between an airborne disease versus an aerosol transmitted or aerosol particle transmission way of, an aerosol particle transmission?
No, I think that it should have been right from the beginning airborne, because it wasn't well understood in the very beginning. But it is an airborne disease, so that the airborne implies that it could be transmitted through the air. Without you have two people in a room, they're not touching at all. They are separated, but they could still one person could infect the other person.
Right. Professor Dhanak, it was a pleasure talking to you. Thank you so much for joining us and enlightening us.
Thank you. It was a pleasure talking to you.
Thank you.